Now.
On 105.9 FM and streaming worldwide on the WMAL app.
O'Connor and Company.
8:36 now. It's Larry O'Connor alongside Mercedes Schlapp for a rare Monday appearance here on O'Connor and Company. It's always good to have you, though, Mercy.
My goodness, Monday is like news day.
Yeah.
It's insane.
It's always a crazy busy day here, but that's how we like it. Keeps us focused, keeps us going. We got a lot of victories ahead of us, folks, and because of that, we like to focus on some of the great warriors, the tip of the spear on so many different fights that we've got. One of them, of course, is our friend BILLBOARD Chris. He's Chris ELSTON, and he brings to the table today the author of a report that we discussed last week, Mia Hughes. Chris, Mia, thank you for joining us this morning.
Thank you, Larry.
So, Mia, let's start with you, because this report says that there's this think tank, Environmental Progress, that says hundreds of messages from an internal message service for a group called World Professional Association for Transgender Health, WPATH. It's an internal forum where they discussed what appears to be their knowledge that puberty blockers and hormone treatments prescribed for children who are going through what they euphemistically call gender-affirming care, that those drugs appear to be linked to cancer. Is that the nut of this whole report?
That's certainly one of the main points that stands out, is a very chilling conversation where a doctor talks about a 16-year-old girl who's on testosterone and has large liver tumors. And it's her oncologist and surgeon think it is linked to her hormones. And then another WPATH member weighs in with an anecdote about a trans-identified colleague who died of liver cancer after years on testosterone, and they also linked it to the hormones. So that's one of the, obviously, the most worrying and serious side effects you could imagine.
But it's also worrying and deeply disconcerting that the medical professionals involved in these procedures don't say this publicly. It's what they say privately, certainly. And it should be noted that none of these drugs were ever tested in any real way for this application, right? That these were not developed for children and this so-called gender-affirming care, or am I wrong about that?
Oh, no, they certainly weren't. I mean, we have absolutely no evidence that giving testosterone to females is safe. We certainly know from the East German doping scandals of the past that testosterone in females has very, very harmful effects on the body. We have no evidence that puberty blockers are safe for adolescents. We have no evidence that long-term use of estrogen in males is safe. And yet, this is an organization, WPATH, that advocates for this to be the first line of treatment because they believe helping a child accept the reality of their body, they believe that's something akin to conversion therapy. So they advocate for this experimental treatment pathway as the first line of treatment for a very vulnerable cohort in society.
Let me ask, Chris, how many studies have been out there that would link these drugs, these puberty blockers, to cancer or any other potentially threatening health issues associated with the puberty blockers? Do we know?
Well, there have never been any clinical studies done for the purpose of treating children with gender dysphoria. This drug is used off-label. This drug was actually approved to treat prostate cancer in men, to treat endometriosis and uterine fibroids in women. Same exact drug is given to pedophiles to chemically castrate them. But what we're doing with kids is just a giant experiment, except you can't even really call it an experiment because there are no control groups. There are no randomized control trials. There are no objectives. There's no follow-up. It's just the Wild West of medicine. But we do know that from some small studies that puberty blockers are causing IQ points to drop. We know with a study with sheep that caused cognitive decline. We know that it causes their bones to lose density. A girl in Sweden that was part of a documentary they produced has a condition called osteopenia. She's in chronic pain. There's a mom I talked to in California who they did bone scans for 3 years while her daughter was on puberty blockers, and she lost 11% of her bone density at a time when her bones should be getting stronger.
Right. I wanted to point that out, Chris, because this is the moment where these children, perfectly healthy bodies, are going through this rapid change. We all went through puberty. We know what happens to our bodies, and this is when they thrive. This is when they grow. This is when they develop, and they are chemically preventing that from happening and altering the natural course that the body is supposed to take for literally no reason. And Chris Elston, because you engage in these conversations with people on a regular basis, oftentimes people who have been brainwashed with regard to this agenda, you often hear, do you want a trans daughter or do you want a dead son, right? It's the most manipulative thing, because if you don't affirm this gender transition, your kid is going to kill themselves. Well, there seems to be a pretty big risk of going forward with this as well now, with the cancer that appears to be at least something that that these doctors know about.
Of course, they're playing God with children's bodies. And whether you believe in God or evolution, this makes no sense. If you believe in God, this ideology teaches God made us wrong. And if you believe in evolution, it's essentially saying that somehow 1 billion years of the process of natural selection has failed, and we now need a pharmaceutical company to help our kids be their true selves. We're messing with children's bodies.
Yeah.
This is totally insane. And what's wrong with these kids? Nothing.
Nothing.
They've been taught that they need to be something they're not. That's abusive psychologically, never mind all the physical harm that's happening to them.
Mia Hughes is with us, and she's the author of this report that revealed the discussions on this internal forum of World Professional Association for Transgender Health. Have you released all of the data here, all of the messages that you got? And has there been any response from the organization or from any other medical group saying, wow, this is a serious issue?
We have released all of the internal files that were given to Michael Schellenberger have been released. So my report is 70 pages, and then after the report is every single message that we were given. WPATH has responded with a very vague, very sort of politically driven statement, basically claiming that they are scientific and evidence-based when they are not, and also making a bizarre statement about the world not being flat.
Of course.
Jeez.
Well, and actually to that end, Mia, I know Michael Schellenberger and Matt Taibbi and some of the other journalists who have sort of gone off the reservation here and actually followed facts on issues that are part of a sort of left-wing dogma. Have they gone after you? Are they attacking you for actually, reporting a story, something that's important that last I checked journalists were supposed to be reporting on?
There's been some response, but I haven't been paying very much attention to the noise on the other side. I'm sticking to the message. I presented their words as they said them, and then I just put it into a historical and scientific context. So I'm confident that everything I said was true to the best of my knowledge, and I'm not really paying that much attention to what the other side is saying right now.
Excellent.
So are the doctors going to do anything at all? I mean, the doctors are the ones also pushing this. Why is the medical industry so involved in making our children into these hormonal experiments?
I believe that everyone has been duped by WPATH. This is a political activist group that presents itself to the world as being a scientific and medical group. And it's a very convincing facade. They have a very carefully crafted public image. And I think everybody has fallen for it, and they've gone along with it because they believe WPATH is doing all the science somewhere, and they really do have the evidence when they do not. So it's really time for the medical world to wake up to the fact that this is not a real scientific organization, and to reject their approach to gender-affirming care and then protect children.
Yeah, I'm seeing you being referred to as an anti-transgender extremist, Mia Hughes. So I guess you're over the target.
Join the club.
Yeah, and Chris Elston, real fast, where can people catch you? Where are you these days as people are engaging with you on street corners and also sometimes yelling at you? Where can they find you next?
Well, I'm heading to Australia next month, so that'll be fun. But I'm also heading to Washington State and Nashville pretty soon. And I don't know, I'll be all around. I'll be back to D.C. and hopefully we can get together for coffee or something.
That would be great. In the meantime, keep up the great work, both of you. You deserve support. You deserve accolades. Mia Hughes, this is the kind of reporting that used to win awards. But, well, we come up with our own awards, and we'll be giving one to you, all right?
Thank you so much.
It is, sadly, we're out of time, though. It is 8:46.